Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. First up, NFX Life Sciences recently announced that it has exceeded its enrollment target of 450 patients for its ongoing Phase 2b/3 study evaluating its investigational agent blarcamesine, formerly known as NFX 273, in patients with Alzheimer's disease. Top-line results from the study are expected to be announced by mid-2022. The double-blind, placebo-controlled 48-week clinical study is using the Alzheimer's Disease Assessment Scale Cognitive, or ADAS-Cog, and the Alzheimer's Disease Cooperative Study Activities of Daily Living, or ADCS-ADL, subscales as primary endpoints to assess the cognitive and functional efficacy of blarcamesine. Patients included in the study will be randomized 1:1:1 to two different blarcamesine doses or placebo. Blarcamesine, an orally available investigational agent, will be evaluated on sigma-1 gene expression, a pre-specified precision medicine biomarker. This gene expression was correlated with direct measures of clinical benefit, cognition, and activities of daily living and function in the previously completed Phase 2a study, the first genome-wide search for biomarkers associated with therapeutic response in Alzheimer's disease. Next up, analysis presented at the 2021 Cure SMA Research and Clinical Care meeting showed that higher nusinersen levels are associated with greater disease of plasma PNFH levels in patients with spinal muscular atrophy and may lead to clinically meaningful improvement in motor function beyond that observed with the approved 12 mg dose. The pharmacokinetic and pharmacodynamic model indicated that patients exposed to higher nusinersen cerebrospinal fluid were correlated with greater efficacy as measured by the change from baseline in Children's Hospital of Philadelphia Infant Test of Neuromuscular Disorders, or CHOP-INTEND scores. Furthermore, exposure levels also predicted clinically meaningful increases of at least 5 points on CHOP-INTEND. Nusinersen, an antisense oligonucleotide administered intrathecally, received FDA approval for the treatment of children and adults with SMA in December of 2016, and since then, the drug has had a multitude of studies conducted to further demonstrate and confirm its efficacy and safety in this patient population. Lastly, data from the Maternal Outcomes and Neurodevelopment Effects of Anti-Epileptic Drugs, or MONIAD, study showed that children of women with epilepsy taking anti-seizure medications did not differ in neurodevelopmental outcomes compared to those of healthy women. Overall, investigators found no significant differences between children of women with epilepsy versus healthy women for the primary language domain outcome, and in the full model, significant factors such as higher maternal IQ, birth weight, and female child sex were associated with higher language domain scores. The study authors wrote that this is encouraging finding may be due to the use of newer ASMs with the lower risk of affecting immature brain. However, these findings must be interpreted within the context that neuropsychological assessments conducted at 2 years of age are not as strongly associated with adolescent/adult functioning as assessments performed in older children, which will be conducted subsequently in the MONIAD study. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.